Hello and welcome to this session on sharing of expertise and experience from our partner organizations. I am Phaedra Charlton, Director of Communications and Marketing for the World Ovarian Cancer Coalition. With close to 200 patient advocacy organizations around the world, we wish we could share examples of good practice from you all, as you're all doing exemplary work where you live. However, for this session, we have invited three in particular to talk about their work in the United States, in Ireland, and in the Czech Republic. These were recorded earlier this month, and there was more discussion than we could fit into this session. So for the benefit of everyone and to do the conversations justice, we are happy to present the unedited conversations, which you can access below in the additional sessions section. First, we turn to the Czech Republic and Veroniká Cibulova, who will take us through the work she was involved in building a media campaign for this year's World Ovarian Cancer Day.
Ladies and gentlemen, thank you so much for having me. It's such an honor to be part of this amazing online event. And I'm very thrilled to be able to walk you through my presentation. Hopefully, you'll be able to gain some inspiration from me. And I'm very much looking forward to getting inspiration from you as well. So in my first slide, you see probably 100 of faces of people. These people all wear turquoise masks or turquoise cancer ribbons. They're physicians, surgeons, patients, and their friends. And with this slide, I want to show and I want to express that we strive, all of us in this picture, that patients lead healthier, longer, and easier lives, even though they have ovarian cancer. In this slide, you see our beautiful Prague, and I wanted to give you a context that we're 11 million people living here, so we're rather a small country. We have 17 gynae onco centers here, so it's very easy for every patient geographically to reach a center. Unfortunately, it's not always happening, and patients are not always treated in a center that centralizes patients. We know from our register, which is called Čekanka, that only 50 to 60% of all ovarian cancer patients are genetically tested for BRCA mutation. We can only assume why it is so, but this is what's happening. So we have a feeling that we should change that. Somatic testing is in place here and works very well. And we do have both treatment options with PARP inhibitors for BRCA and non-BRCA patients here. This treatment is covered by insurance companies, so we're very fortunate with that. Hereditary clinics work very well. And like I said, ovarian cancer patients are unfortunately not always treated in centers with high volume. We're very happy that we're able to collaborate with a Center of Excellence in Faculty Hospital in Prague, which is run by Professor David Cibula. This is the only hospital in the Czech Republic that has this ESGO accreditation for advanced ovarian cancer surgery. It belongs among, I think, 20 other centers in Europe. So it's an amazing collaboration that we have with them. So let me start with the goals that we had in our awareness campaign. We're trying to raise awareness about genetic testing, but we're trying to simplify the identification criteria because they're quite complicated, and not only for the general public, but for some surgeons, for some physicians as well. We're trying to say to people, look around in your families, and is there any significant number of tumors in your family? Do people get sick in a very young age with tumors? And this is like the message we're trying to convey. And then if it is so, if you're the case and you have a significant number of tumors in your family, go ahead and consult this fact with your gynecologist or with your general practitioner. We have many educational materials written by our KOLs, and we spread them among other centers in the Czech Republic. We're also collecting patients' testimonials because we have very good feedback from patients that they hear authentic stories that they can believe. We try to talk about BRCA mutation from a different angle because I'm sure you all know when you talk to journalists, they always ask you, what's new? And it's not always the case that there's a lot of new things happening. So this year, we have included a pathologist and a biologist who talked about somatic testing and the register that I've already mentioned. And it was very interesting to really see the mutation from a different angle, and it made a good impact. We always repeat that patients should be treated in centers, and we explain why it is so. And we ran this campaign continuously this year. So we started on the 7th of February, which is the World Cancer Day, and we finished on the 8th of May when buildings in Prague were lit in turquoise color, and we held a huge press conference. We didn't do it alone. It's always a team collaboration, and we joined forces with Onkounie and Nadační fond Hippokrates. These are the testimonials that I mentioned. The lady to the left, she is a patient. She had ovarian cancer, and she's living now a very high quality life. And the lady to the right, she's healthy, but she has BRCA mutation. So she talks about prophylactic operations. These are pictures from our press conference that we held on the 8th of May. And I'm always very happy when I see full house and I see all the 3 main TVs that we have in the Czech Republic, because this way I know the message is going to be spread everywhere. In this picture, you can see our TV anchors wearing our cancer ribbons. There is a nice story behind it because the cancer ribbon is made in my hometown with Swarovski crystals, and it's made by a patient of ours. Here are some of the media releases that we had. Like I said, we were very successful this year, so we had a lot of them. And the impact that we had with this message was 23 million non-unique viewers or readers. So when you think about it, we must have touched just about everybody, probably more times than once. So I'm happy about it. But to be able to measure the success, we always carry out a survey. We did it last year. We're going to do it next year again, that we ask people if they know what BRCA mutation is, if they're able to explain it, if they make the connection maybe with Angelina Jolie. And this way, we're able to measure really if the awareness has increased with our campaign. My kind of learning for next year, what I would like to do is I would like to address directly gynecologists and oncologists, reminding them of indication criteria. And we're offering them this sticker that they can put on a desk or on their computer to really have it constantly on their mind that there are these criteria they should think about, especially in healthy women. We're trying to make them think about the whole family, the history of the family, to uncover the BRCA families, I would say. So this is our big aim. New topics are also going to be sexual health and mental health, as well as second opinion, because here, and I'm not sure if it's your experience as well, but here people are sometimes like hesitant or embarrassed to ask second opinion because they have a feeling that their physician might get offended, that they're looking somewhere else and asking somewhere else. So we want to explain that it's perfectly normal and it's okay to ask second opinion somewhere else. This is the whole team that's behind it. Thank you so much. And thank you again for this amazing opportunity to share it all with you. Thank you.
Thank you, Veronica. That's what an impressive campaign you pulled together. And I think a lot of people will be wondering, when did you start planning this?
Yeah, we started quite some time ahead, like 3 months probably ahead. because we need to prepare the press release, and then will be spread among journalists. Yeah, so like 3 months ahead, I would say, we have a meeting and brainstorming and discuss what should be done and like what's missing.
These days, it's so hard to get in front of a lot of journalists and get them in the room. So how do you go about engaging the media, and how do you get them in the room?
Yeah, I have to say that we have very good relationships with them because we offer high quality content. I mean, I get them the best people, you know, that really are the KOLs in the Czech Republic, and they do have high quality stuff to say. So this is the first thing. Then they always want patients to give them their authentic story and feedback, how they were treated, how they were diagnosed. So of course, we're able to provide them with this as well. And then, I don't know, maybe, you know, it's the team behind it. We're all good and do our best.
Well, it sounds like it for sure, and you definitely see the results. And so what advice would you give to, new organizations, let's say, that don't have maybe the connections that you have, or just starting out thinking that they want to do a media campaign? What advice would you give?
I would probably tell them to talk to the physicians and the surgeons and geneticists, and maybe ask how they view it, how they perceive the situation. I would definitely search if there is a register to really see if people are tested, that I would try to find out if they're treated properly. And if not, if the information is not out there for people that there is a new targeted treatment, for example, I would try to spread the news. And also, it's very good to be authentic, to really hear what patients have to say and then put it all together. So, like, to really meet the needs that are there in the market. For example, we ask patients now, during their journey from being diagnosed all the way to being treated and then having a follow-up, what do they miss the most? What do they lack? And typically what they're saying is that they missed more sympathy and more like empathy from the physicians and psychological care. So this is something like a new topic that we want to open next year, together with talking about BRCA again, of course, but then maybe adding this part to cultivate the whole society. And also, I'm thinking it's good that, you know, patients see that we care. They see that something's happening. So this is important to them, that they know that the cleverest minds on earth are investing a lot of time and energy and money to help them. So it's important for them to see that we're trying to help and do our piece as well. So I would say, don't forget any part. Involve patients, involve physicians, and then all together, having a good team like I have in patient organization, it all works.
COVID-19 certainly forced many of us to take stock, not only of the day-to-day services that are offered, but of our organizations as a whole. Melissa Aucoin chatted with me about the journey that the National Ovarian Cancer Coalition took during their strategic review.
First, would love to start with just a little background to help you kind of understand what led to our decision to think creatively in our strategic plan process. Being a relatively new CEO coming on board, I really wanted to make sure that we were being very thorough. I was doing kind of a listening tour and understanding what our biggest challenges were and where we were as an organization. COVID just kind of happened ironically at the same time. So I would say, our plans were to have something in place by 2021. So we started the process in 2020, really right as the pandemic, really kind of the onset of the pandemic. And so I do kind of feel like COVID did create a level of urgency that we wouldn't have had otherwise. we thought very creatively about, what could we do to combat some of those experiences that they were experiencing. I'm a firm believer that the patient has to be the center of everything you do. And so we tied back, everything that we were doing at the time. We asked ourselves, a few pointed questions. Is this really serving the need? How is this filling the gaps? And so a really big thing for us in the process was turning to our community relations team, our boots on the ground, so to speak. These are the folks that are working with our patients and with our ovarian cancer community daily, and really understand, what their needs are, what their challenges are. They're hearing from them every day. And I felt very strongly that they needed to be part of this process in order for us, to truly, again, meet the needs. We also knew that we wanted to take that 360-degree approach. I would say that we didn't know that it would end up as cohesive as it turned out, to be honest with you. That sort of piece just happened organically, but I will tell you, we involved the board as well as the staff. And the first starting place was, taking a look at our infrastructure. So we took a look at everything, no stone left unturned. We looked at our mission statement, our vision statement as an organization, our key health priorities, as well as our values as an organization. It was something that we had never really even considered then. And so I took all of that foundational work back to our staff members, particularly in the local markets, and said, okay, this is, who we are and how we're operating as an organization. I will say, once we had alignment in our vision and we kind of knew who, we tackled the 5 health priorities. And once we had this in place, we really looked at assessing and evaluating. So I think one of the major wins for us in this whole entire process was hiring and investing in a staff person that was dedicated and specialized in assessment and evaluation, program assessment and evaluation. So in terms of, engaging with our board and staff, I think, I did a lot of listening, in one-on-one environments. I really wanted to understand at every position what some of the challenges were, what they were having to deal with, why they couldn't necessarily meet the needs of the community. Where did they feel like were the biggest gaps? And so meeting with them in that one-on-one setting, I think, helped them kind of just understand exactly what I was trying to achieve, and that I wasn't going to come in here as a new CEO and, start firing people and laying people off. It was part of a strategic plan. It was part of a process, and that we were all going to do this together and have a hand in it. We decided to do a 3-year plan. I had thought at one time that I wanted to do a 5-year plan, but the 3-year plan seemed to make sense given the instability that we were seeing in the economy and in just, the area. And so I thought that, the 3-year plan might be a better and easier lift for us. That way we could kind of reassess if we had hit the mark or whether or not we needed to do some more refinements.
How important did you find was it to be, for want of a better word, messy in the process, letting everything kind of just come out? I mean, a lot of people think, strategic review. Sometimes people get into the mindset, well, it has to be very structured. It has to be, 1 through 10 checklists, that kind of thing. And it can be kind of intimidating in a sense. But how important was being kind of messy and organic ultimately?
I think that's really what being messy with it, I think, is what helped us rally our team and really what helped us bond together as a team. I felt like we were just, okay, we're in it together. We know this is going to be messy. We know it's going to hurt, but I think, we obviously, are going to hit some pain points, along the way, but I think they appreciated that just authentic approach to it, and not feeling like they were being told, that they felt like they were part of the process, more or less. And so I do think it was a big factor in our success overall.
And so do you find that the listening, the one-on-one, and that really kind of personal approach within the organization, did that ultimately help the team take ownership of the strategic plan? That, like you said, it's not something you're telling them, but it's something that they see that they've been a part of and that they can kind of own taking forward?
Absolutely. I think, they coming in as a new CEO, that was, a big factor. I wanted to make sure I was understanding what I was really going into. And so I think they appreciated the fact that I wasn't trying to come in and just automatically make changes based on my prior experience. Every organization's different, and I really wanted to understand, again, what they were dealing with, what they were coping with. And I think they appreciated having their voice heard, and that I was looking at them as the expert, right? Because the reality is, I'm a CEO and I'm sitting in a seat in Dallas, Texas. I'm not, talking to the community daily like they are. And so I really did rely on them a lot for their expertise. They are experts. They're dealing with and talking to patients every day. They understand their stories, and that is something that I cannot offer.
And so I guess just to kind of wrap up, you talked about pain points. So how important is it when you're undergoing a strategic review, do you feel, to let things go?
Ironically, that is one of our biggest pain points right now. It's just understanding our capacity as an organization. We still have so much that we want to do and we want to achieve. And so I think, like I always take I think recognition is really big in that, because it helps them feel like they're still accomplishing things, and they don't feel like they have to keep, delivering and keep, we don't have to keep developing new programs, every few months, like that's not achievable. And it's something that, as an organization, we really need to, again, take a step back and really understand what we can and what we do have the capacity to do and to deliver on. And so one of the things that we've done just recently is, met as a group so that kind of doing some cross training. And so that we understand that with every initiative, how launching or executing that initiative impacts every single department and every single person in the organization, so that they're understanding, it might seem like an easy lift to you, or like, oh, I can do this, I can make this happen. But they're not really factoring in how that impacts, our marketing department, how it impacts our operations department, how it impacts each of our individual departments and the workload that they're taking on. And so it's been kind of a learning process for all of us to kind of understand our roles and at a deeper level, and understanding, what we need to have in place in order to do any specific initiative we do. Like right now, for instance, we're working on, we have a national conference coming up in May. And again, we're throwing out some really great ideas, but we always stop and go, okay, who actually is this going to impact, and, how much work is it going to put on everybody's plate? And so that's still always going to be hard for us, again, because we're really passionate about it. And we would, a perfect world, you want to see your strategic plan come to fruition, within the first year. And so it's hard to kind of take a step back and go, we've got some time. Let's slow down a little bit and be a little bit more methodical in our approach and ensure that we've got this before we take on too much.
This video captured just a flavor of their process. So if you're interested, please come back after and watch the full conversation with Melissa below. Our final guests, Sharon O'Toole and Anne Murphy from the Irish Network for Gynaecological Oncology, join me to talk about their work in bringing together their network spanning the island and the importance of persistence as they sought to collaborate.
So thank you very much, and thank you for giving us this opportunity to talk to you today. So I'm speaking on behalf of the Irish Network for Gynaecological Oncology. So the network comprises over 30 groups across the island of Ireland. And all of these groups, I suppose, are dedicated to raising awareness of gynecological cancers in Ireland, but also advocating for women impacted by gynecological cancers. And as you can see here, our map of Ireland, our aim is to have a dot in every county in Ireland, but at the moment we have many groups spread across the country. The majority, I guess, being based in Dublin, and we're fortunate to have our National Cancer Control Programme as part of our network, but also some of our national charities such as the Irish Cancer Society, Breakthrough Cancer Research, many smaller groups and voluntary-led organisations working in the area of female cancers and gynecological cancers, and many of our support groups also across the country. So we're delighted with this network, and we have been working together now for a number of years, just raising awareness of gynecological cancers. Our two big awareness days are World Ovarian Cancer Day and also World Gynae Oncology Day. So really, I suppose in terms of ovarian cancer, what is really driving us here in Ireland is that we have an incidence of over 400 women every year diagnosed with ovarian cancer, but a really high mortality rate of over 270 deaths per annum. The majority are diagnosed, as you can see here, at stage 3 and 4. And when we look at Irish figures in comparison to our EU counterparts, we see Ireland rates up here as the second highest mortality across all of these countries. So this is really worrying. And I suppose for us as a network, we wanted to address this and raise awareness of the symptoms of ovarian cancer. So we very much follow the Global Ovarian Cancer Charter developed by the World Ovarian Cancer Coalition. And really, you know, it's about getting information out there for women impacted by the disease, but also getting information about ovarian cancer out there to the general public. So this year was the first year, we've been working since the very start on World Ovarian Cancer Day here in Ireland, but this was the first year that we actually went out and raised sponsorship and got you know, money from pharmaceutical companies, from other partners within our network also. And it just enabled us to hire some professional help, and we were able to take on a public relations company to help us with our awareness campaign. And this really had an impact in the reach that we had this year. And really our campaign was based around the fact that when we did a survey, 4 out of 5 Irish women were not confident to recognise the symptoms of ovarian cancer. So this really gave us a baseline and a benchmark to work on and to try and improve that statistic. Our campaign was an all-Ireland approach, so north and south we worked to raise awareness. We had impactful scientific research, so our survey findings, and this was delivered by medical experts. So we had our medical experts, you know, delivering the news items. We also had a campaign across the country where we had over 13 patients sharing their story, which had a real impact locally in the various counties around Ireland. We also had some head-turning campaign ambassadors. We worked with a designer, Helen Steele, who designed a tote bag and many other items for us with the Beat campaign. And also we had a beautiful video by Sasha Terfus, just outlining, I suppose, the experience of ovarian cancer patients and what they go through, you know, once diagnosed with the disease. We also had a big social media campaign, and we had, I suppose, all groups were giving the same message out there, and we had the same press release. So it worked really well in terms of our impact. This is just a snapshot, I suppose, of the different items. We had patients sharing their story on the national news. This was the video. We had these beautiful Beat postcards sent out to many of the influencers. And this was the Helen Steele who designed our bag. And this featured, we had many news item coverage. We had a reach of over 8 million, which was really fantastic here in Ireland. This is just a snapshot of all the local radio stations and newspapers that picked up on our story this year and highlighted our symptoms of ovarian cancer. So I guess the benefits of our network, really, we have a countrywide reach, so both nationally and local. We have a unified voice. We're all giving the same message. We really have the support of our clinical colleagues, which is really important because they're willing to join in our campaign, share the message with us, do joint interviews with patients. So I think this was a real key factor to have their support. The network has really, it allows us to share our expertise, knowledge and resources, because for many many of, I suppose, of the smaller charities and voluntary-led organizations, they may not have a marketing person or a PR person. So we were able to lean on some of our national charities for additional support. It also, the network allows us, different sponsorship opportunities, because different groups may have relationships with different companies who we could go to look for sponsorship. But not only for World Ovarian Cancer Day, it also allows us to work on other women's health awareness and advocacy issues. So it's a real benefit to the Irish Network for Gynaecological Oncology. So thank you for allowing us to share that information.
And I'd be curious to hear your perspective as, not only as an oncology nurse, but as an ovarian cancer survivor. How have you seen the development of INGO?
I suppose it's important just put in a little bit of perspective that I came to know Sharon way back when I was diagnosed with ovarian cancer back in 2013. I was finished treatment a year. My sister just died from ovarian cancer. I was working in education oncology. The network, as I said, at some of the meetings, we ended up talking to ourselves, and we realized quite quickly that we needed to get out to the general public, because everybody that was in there had already got a diagnosis or had an experience. And in order to try and bridge these terrible statistics that we have in Ireland, we had to try and bring people to be diagnosed earlier and not later.
Sharon, it wasn't as simple as just pulling everyone together. I'm sure there was a lot of work in creating the network. So how did you do it? How did you get everyone on board?
I guess, Phaedra, it's been building slowly year on year. And, having worked with the patient groups and Ovacare, and many people haven't had experience or even attending some of those meetings, they're hearing the patient voice at those meetings. And then you'll go to clinical meetings and you're hearing, I suppose, the doctor's voice. But even in the background, I suppose, under the Irish Society for Gynae Oncology, we're now merging those two together. And at every Irish Society for Gynae Oncology meeting, we're having patients speaking at those meetings also. So we're bringing the communities together. And I think people are seeing how successful that is, and they're nearly wanting to be part of our network now rather than trying to invite people to join. But it has been building year on year. And because we really document maybe every year what our campaign has been like, and we have that to share with people and say, look, this is what we've done for World Ovarian Cancer Day and World Gynae Oncology Day. Would you like to join? You're more than welcome to join, whoever. And we do have, there are people who will say that they maybe not as active in the network, but they're sharing the message with their community. But it is a lot of hard work. And I would say, we thought this year bringing the public relations company on board would ease the amount of work, but it actually created more work because we had a lot of decisions to make. So it's very much collaborative, and we very much appreciate everyone's input, within the network. And as I said, we'll do a little newsletter summarising, the outputs at the end of the year. And we have that also for if we're looking for sponsorship. Now that we've seen what we can do with some sponsorship, we'll be doing that every year, So, and we have, we have the experience now from this year, because this year was difficult because it was our first time ever doing that. So we had lots of things to contend with and going for tender and developing a brief for PR companies. But we've learned a bit of the lingo now and what's involved. So I think it'll help us going forward.
Sharon and Anne had a lot more to say about their network and the importance of their work in Ireland. So really, I invite you to check out their unedited video below, along with Melissa's. Thank you so much to all of our guests for taking the time to speak with us today. Coming up next, Frances Reed, the Coalition's Program Director and Every Woman Study Lead, will give an update on our Every Woman Study Low and Middle Income Edition. You can access that session here on your left. Thank you so much.